Hello, my name is Joe Wyboda. I'm the CIO at the National Rural Health Resource Center, and today we're going to talk about vendor issues management, or as some people like to say, I'm right and here's why. Vendor issues management is an important topic in health IT, and one that I often get asked about is how do I get the vendor to do what I ask them to do. And today we're going to talk about that in terms of a partnership as opposed to what some people think is a more adversarial relationship. Before we do that, I'd like to introduce the National Rural Health Resource Center, which is we're a nonprofit organization, and we work in 5 core areas: performance improvement, health information technology, which is primarily what I do, recruitment and retention, community health needs assessments, and networking. So check us out online at ruralcenter.org. So we're going to talk about vendor issues management, which is about getting your issues resolved in a timely manner. It's not about you getting your way. We want to make sure that we consider the perspective of the vendor. Anytime you have a conflict, it's a good idea to try to understand where the other person is coming from, and that's what I'm going to spend a bit of time on today, so that hopefully you can see things from their perspective, and kind of contrast those differences. Sometimes we have competing sets of values, some competing differences that can cause misunderstanding between the two, between the provider and the IT vendor. And we'll talk about some techniques you can use, not only to track your issues, but to get the issues that are most important to you resolved as quickly as possible. And don't forget that the point of this is that the vendor is your partner. The vendor is not an adversary. This needs to be, I'll stress this a few times, but you have to keep in mind that it is a partnership. You really do rely on each other. So let's think about the vendor first and what their point of view is. And what I kind of did here was use a kind of a Maslow's hierarchy of need concept. At the bottom, at the core, kind of their existential stuff is they need to really sustain their business and avoid liability. Vendors are very liability conscious, and if you take a look at your contract, that's how they try to limit that liability. And the limitation of liability is that section of your contract that is all capital letters. That's a reason. They are very nervous about liability. So they manage that part of their hierarchy of needs with contracts. Sustaining the business is that's critical to them. And as we move up the list, it's profit, keeping those existing customers and acquiring new customers, probably in that order too. You've probably all heard, getting a new customer is much more expensive than keeping an existing one, and so they put in a lot of things to make sure that they can sustain and profit off of their existing customers. Things like support fees and being efficient in their support, making sure that if they do find a bug, that they fix it quickly rather than letting it fester and become more of a support burden. They also put a lot of effort into product development to make sure that they keep those customers and acquire new customers. And then think about the top is it's very expensive to hire new employees. They have a need to engage employees and make a difference in the communities. When you talk to vendors, and the higher up you get into the vendor's organization, you'll find that making a difference in healthcare as a whole is important to them, just like it is to you. Now let's think about the healthcare provider's hierarchy of needs. And yours may not be exactly the same, but I'll bet it's pretty similar. At the bottom, there's you want to sustain the business. You want to keep the hospital, the clinic, the home care organization around. That's important. Financial security. You want to make sure you have days of cash. You want to make sure that your facility is sound. And a lot of places will manage that using a balanced scorecard. Moving on up the the hierarchy. There's patient safety, clinical quality of your clinical care, and making a difference in the community. You see how that is actually in a different spot on the hierarchy of needs for a healthcare provider than it is for the vendor. And how you do that is with quality metrics, having maybe a safety program. If you're trying to improve falls, you might have a falls prevention program, for example, and implementing electronic health records pretty high up. And then engaging employees and physicians is critical, particularly in rural where it's so hard to get physicians and good staff. Keeping them engaged is there, and a lot of places will have a workforce development program. Think about those competing needs. Both of you want to, both the vendor and the healthcare provider want to sustain their business, and where the EHR gets in the way of patient safety, quality, making a difference in the community, that can be areas where the vendor and you get kind of crossways with each other. Another way that I like to look at this is a little bit of a matrix that talks about issues, because today we're going to talk about issues management, and this is one where this is a little matrix that I put together that might help you understand the importance of an issue. One on the two axes here, I've got number of users affected is on the Y, the up and down axis, and the level of I guess risk on the X axis. So something that isn't really much of a risk, it's more of an inconvenience that doesn't affect many people. Your vendor is probably going to think about that as an annoying issue, maybe something that's a non-issue is what they might call it. Doesn't affect many people, it's just an inconvenience. That's that little green one in the corner. You probably have a workaround for it. Maybe the provider is using the system improperly, not the way it was designed. Many of us do that. This is probably the type of issue that's not worth fighting over with the vendor. You usually call this an enhancement request. On the other hand, if you have something where it doesn't affect many users, but it's higher on the list of patient safety risk, then it's going to be something that I would call an important issue. It may affect a few users, but the fact that it doesn't affect too many people means that it's less well known, that people could stumble into this problem in the system and potentially cause harm. And a lot of people will use a system of checks and balances. So if you have a problem where occasionally when nursing orders a particular test, the notification doesn't get to the lab in a timely manner, maybe you follow it up with a phone call, right? I mean, it's a system of checks and balances. This is one that will require escalation on your part and tracking until it's resolved, but this is one that your vendor will look at and be more aware of as well. Don't forget what they want to avoid at all costs: liability. And this one could be a significant liability, just like a critical issue, one where there's a significant patient safety risk and everybody's affected. You'll want to escalate that immediately. So the point of this graph is to really get you thinking about ways that you can measure and consider the importance of a problem and how much you really need to chase after that issue. These are probably the issues that you need to track down the most. But that doesn't mean that non-critical issues or annoying issues, just you don't do anything with them. These are things that you want to track and be able to look for enhancements on. But you don't want to necessarily be the boy who cried wolf, and every time there's a non-critical issue, run it up an escalation path. Here's another way to look at it, and this is one where there's the support organization at your vendor. This is the axis that they are most likely looking at when when you call in an issue and it gets put into their tracking system, this is what they're going to be looking at. Is on one axis, how much risk. The same thing that we talked about on the last slide. And in addition to that, they want to know how many customers are affected. So if it's something that's a low risk, but every customer is affected, that's something that they'll look at a little bit more than if it's low risk and nobody's affected except you. Then going on the y-axis, it's the amount of effort, and they are really going to be driven by this. So think about what that means. If you have something that's low risk that is going to take a lot of effort, that's that blue square. That's probably something that won't get done. You may have to have that done as a paid enhancement. Could take a long time to get completed. You know, since it's low risk and it's going to take a lot of effort, your vendor is going to think that this is something that's not going to have a significant enough payoff. On the other hand, if it's high risk and doesn't take much effort, that yellow box, that's going to go to the top of their priority list. If it's there too long, it'll probably end up in that red all hands on deck. These high risk, considerable effort problems. Remember, the vendors really want to make sure that they are minimizing their liability and their risk. So they're going to look at one that's going to take a lot of work, that has a lot of risk, that they'll pull programmers off of other projects, and this will be the enhancement, the fix will go out to customers quickly, as opposed to a prioritized issue, which will get in the queue and maybe nothing will ever happen to it because it might not take much effort, but it doesn't affect a lot of customers or it's low risk. Keep in mind the kind of competing measures here. With the healthcare provider, you're typically looking at how much risk and how many people are affected. If it's something that affects one department, it has a lot less importance than one that affects every user. Or if it affects one department compared to another, maybe the nursing might have a little bit more priority over another department. They're not necessarily looking at that as much. They're going to look at effort versus risk or number of their customers affected. That's kind of their critical variables. So let's talk a little bit about what some examples are of issues. We talked about serious issues. One would be something where orders are missed. That would be something I'd classify as a serious issue. Reliability can be a serious issue. If you have frequent outages because of software flaws, that can be a serious issue, right? Because now you're going to have people that are going to look for workarounds or ways that they don't have to use the system. They just go back to a paper process, which may be less safe. That can be a serious issue. Something that's a non-critical issue, and these are things that I oftentimes see people sending the high priority emails to their account manager saying that this is something that's critical, we need to get fixed right away, right? A productivity waster is a good example. Something where maybe the screen changes are slow. Maybe it's something with look and feel that the physicians don't like the way this looks, or even a productivity waster. They have to go to two different screens where on paper I used to do it on one sheet. Those might seem important. They might be something that would really help with physician engagement for you, but they're not going to be a serious, a critical issue. These are going to be minor issues to your vendor. Non-issues. These are the ones that, all the screaming in the world is going to get your vendor not to engage. It's not going to make a difference. Things where you're having reliability problems that are due to your inaction. If the vendor told you that, your server's old and it really needs to be replaced, and it's got a corrupt hard drive, if you don't do something about that, that is not going to be an issue for them. They are going to not work as hard on it moving forward as you would hope. Same thing with problems due to a PC. If you have, if your plan to replace personal computers, desktops in your organization, if you don't have a plan that replaces a certain fraction of them every year, and you have areas that have, ancient computers, those are going to become non-issues as well. And this is the one that I see as probably the most common non-issue and frustrates vendors and healthcare providers the most. And that's one where you've overlaid an already poor workflow that was paper-based onto the EHR and kind of strong-armed the EHR into taking your process that you had before and replicating it electronically. You just have to do that process improvement and workflow redesign. If you call in saying the system doesn't work because the system doesn't work the way we need it to because we're trying to have it do an old process that really needed to be redesigned, they're not going to respond to that. So it's important to look at your workflows. So how do you? We talked a lot here about looking at things from the vendor's point of view, understanding how things get prioritized. How do you manage that? What are some of the techniques you can use? I'm a big fan of an issues list. That oftentimes when we implement an electronic health record, the project manager from the vendor will set us up with an issues list, something that you want to use to keep track of those issues. And especially during pre-go live, it's shared or even supplied by the vendor, and they maintain it. Post-go live, too often the only time we pull out the issues list is when we have a serious issue, and we're mad because the vendor's not performing. They're not updating their software fast enough, so then we put together an issues list and set up weekly calls. Really, we should have that issues list be something that we maintain actively. And some vendors are very good at this, that they will make sure that you have an active issues list that they still maintain, and your account rep will go over with you. I'm going to show you an example of a nice issues list from the Small Hospital HIT Toolkit, which you can find on Stratus Health's website. Just Google Stratus Small Hospital HIT Toolkit and you'll find it. But I'll go over some examples from that. Sometimes collaborative efforts can be extraordinarily powerful. If you're in a network where many of you have the same vendor, if you start to make friends as much as you can with other hospitals or clinics or other providers that have the same vendor, teaming up if you're all having the same problem can be extremely valuable. Very, very beneficial to you and your peers. So consider teaming up with a larger facility as well. If one of the problems you're having is also a problem with a tertiary facility that you refer to, that can have a lot of benefit that they see it's coming from more than one place. Some other techniques, user groups. Most vendors have a user group that meets perhaps at their annual meeting, or sometimes they will have user groups that are regional. This could be a great forum. You have to make sure you bring your issues up in the proper context. That I've seen folks that go to a user group meeting and will use it as an opportunity to lambaste the vendor, quote unquote. Sometimes there may be a place for that. I'll get into that a little bit, but make sure that when you bring your problems up, that you use as much tact as you can, and try to make sure that there's consensus. If you're the only one having this problem and it's because of the way that you implemented the system and overlaid your bad workflow onto an electronic system, user group meeting is not the place to bring it up. But again, user group meetings are a great place to seek out collaboration. Oftentimes at the user group meetings, I see folks that will do a geographic collaboration effort, right? They'll find somebody else who's in their state and make friends with them, and that's a good thing. You know, you can drive to them and you can talk with them. You know, frequently they're in your time zone, but sometimes it makes more sense to look at people who are more like you. So if you're a critical access hospital that owns a clinic and is interfacing with a third-party clinic EMR, that'd be a great one to seek out somebody who's got the same combination as you do. If you're CPSI with eClinicalWorks in the clinic, it'd be a good idea to find somebody, regardless of where they're at, who's at the same with the same vendors and at the same level of adoption, right? If they're just putting in the clinic system and you've had it interfaced for years, they may be somebody you want to get to know, but not as much as you want to get to know that person who's at the same level you are. So let's talk a little bit about that issues list. These are some of the fields that I think are important. If your vendor has a reference number for their tickets, just about every vendor does. You know, you want to have that detailed description so you can include follow-up. I think it's important to have an assessment of risk or priority for each issue. This puts it, you know, into terms that are important for both you and the vendor. If something is low risk but it affects a lot of users, maybe you want to have that. So which modules are affected, what users are affected, keeping that information, like who reported the problem. This is something police work does, right? A chain of evidence. Let's go back to the original person who said that they had the problem. Or are we sure we really understand it? Sometimes after an issue has been on a list for a while, we forget the details of it and it gets morphed into something that doesn't make sense anymore. So it's good to have the original person who reported the problem on there. Who it's assigned to, who's got the next steps on it. Very important one, and you and the vendor need to agree on who has that next step, who it's assigned to. Some of the other points that need to be on there, on that issues list, are when the issue was assigned and the date of follow-up. So, you know, it's good to have when it was first assigned so that you can track, you know, this one's been on here for 9 months and we think it's pretty high risk. And then kind of that escalation, who it's been escalated to, and, you know, the resolution and date. If the problem was resolved, if it's going to be resolved in a future release, if it's going for voting, whatever that resolution is, include that on there. And then the resolution date is always nice to have, so you can go back and say, you know, you guys did great on this. It only took a month to resolve. But look at this one today. It's taken over a year. And then it's important that the resolution is something that you agree that it's resolved, not that the vendor says it's resolved. Kind of common sense, but sometimes I've seen situations where you know, the support manager has quarterly bonuses coming up, and they want to make sure that they have, you know, as few tickets out there as they can, and things will magically get resolved, closed. You got to make sure that doesn't happen to you. Make sure that that you agree that it's resolved, and you learn to use your vendor tools. Many vendors have really strong help desk systems where you can look up and submit and you know, view tickets. That if they do have that, make sure you learn how to use it to your advantage as much as you can. Some EHR vendors work best when you submit tickets electronically. Some do best over the phone, but at least follow-up is usually best through that ticketing system. You get the information right from the horse's mouth. It's really a good way to go. Here's a example of a spreadsheet, and you can see it's kind of cut off, but these are some of the. This is actually the spreadsheet from the Small Hospital HIT toolkit. So feel free to download that toolkit. There's some great stuff in there. You can see that third column, risk, high, medium, and low. That I think is very important. So how do you use the issues list? I already talked about pre-go live. We all seem to use an issues list. And post-go live is where it's really important. It should be a core part of how you manage your IT systems. This is kind of a core competency for IT staff, is to maintain this issues list. And I do believe, being an IT person, that's kind of where it belongs. That your IT steering committee should be reviewing it at every monthly meeting. If that list does get too large, then it's time to have maybe the more periodic meetings with the vendor. And we'll talk a little bit about how you escalate this stuff. And it is pretty vendor specific, but there's some generalities we'll talk about. If it's bad enough, you might want to have weekly status meetings with somebody from the vendor. Usually the person to talk to get this escalated is your account manager, and then ask that account manager for an assigned project manager, or even a developer. Developers can be really hard to get access to, but if you can, they can be some of the most beneficial people. And that's one of the reasons is that they don't want to grant access to developers, is because their job is to develop, not to manage customers. Collaboration, we talked about this as a technique, and collaborating with a peer can be very powerful. If you're still using the issues list, you may want to have a shared issues list that says, all of us peers are having this problem, and here's our list of the priorities and dates. Again, get to know those hospitals and clinics that are similar to you, and I can't stress that enough. The same level of adoption is very important. Similar size is important. Geography is not so important. Unless it's specific billing issues for Medicaid or behavioral health, has very specific state-based reimbursement. Geography is not that terribly important. Adoption and size are probably more important. But having calls with your peer partners and with the vendor, especially if you're in a pretty serious problem situation, can have a lot of benefit. I know with our regional extension center, we have in Minnesota a peer group with a vendor that has monthly calls, and it's been extremely beneficial for both the vendor and those hospitals, because the vendor has learned some issues that they didn't think were very high priority, and they learned why they were priority. And it really did come down to those competing axes on that matrix I showed you. You want to be careful that you use this when there are critical issues. Oftentimes I see these groups turn into an enhancement request feeder that it turns into more of a whining situation. You want to make sure that you find a way to end that group if their work is done, and make sure that the issues there are things that are benefiting you and the vendor mutually. We talked a little bit about user group meetings earlier. We want to make sure that you use those to the best of the best way that you can. And networking with peers is good. But bending the ear of the vendor executives can be very beneficial. Every user group meeting usually has some sort of a welcome reception where they give out some wine. Good opportunity to seek out the higher ups in the vendor and tell them those core issues, especially keeping in mind if it affects safety and if it affects a large number of users and it's something that they can fix. The vendor hears that, the vendor executives, they can really make things happen. But you want to make sure you don't sound like a chronic complainer. There are folks out there that will make it a point to bring something up in a public forum just to embarrass the vendor or something. You want to make sure that you don't be a chronic complainer. These have to be issues that have a significant impact on your organization and hopefully on others at that user group meeting, so everybody says, yeah, Jane is right, this is something that needs to get resolved. Escalation is something that is oftentimes misunderstood and poorly applied. So I want to make sure that we talk a little bit about what the escalation path is. And again, I'm generalizing this a bit. This is not the same for every vendor, but almost every problem should start out at the support level, right? That you start out at the bottom at that green support. Most issues should end there. A well-run help desk, the first level of the help desk should resolve about 80% or more of the issues at first level. And then usually there are multiple levels of escalation within support. But sometimes we've all had problems that languish in the support area for a long time, and that's where the support manager can come in. Some vendors have multiple support managers, and you may be able to ask, can I talk to the support manager? And usually that's something you talk to support about. You may not have the support manager's name and number. If you do, that's great. The support manager usually has the ability to redirect a support call from one area of support to another, or even from support to development. That support manager might have that ability to hand it up to development. If you still don't get resolution, your account rep or account manager. Not everybody has an account representative. Some do. Usually the account manager, account representative, their role is to make sure that you are happy. They and good vendors will usually have account managers and account representatives will usually have a monthly or bi-weekly or a weekly report of all of their customers, the support calls that have been made, and how they're doing on resolution. So they may already be aware, but your account manager, it's their job to make sure you're happy. So if you're not getting resolution from support, from the support manager, go up through your account rep or your account manager. If it's still not being resolved and it's been languishing for quite some time, the next step is to go to those executives. And it's important to know who the executives are at your vendor. And sometimes you can ask your account manager, you can say that, what is my escalation path? Would you mind sharing a organization chart with me? Sometimes they'll give you that organization chart with phone numbers on it. That can be very, very beneficial when you're having significant problems. Those executives, you want to make sure you're not crying wolf when you get to that level, that it is a really significant problem that you're not getting resolution to. And finally, the board members. That's an absolute last resort. It's your last place you can go, besides the FDA or something. But at that point, when you start talking with board members, you better be prepared to separate. Because if you're that frustrated and you haven't gotten resolution from the executives, that should be an eye-opener that it might be time to separate from your vendor and kind of be prepared to put your money where your mouth is. If you contact the board members, it's a time when you want to make sure that they are clear that you're not happy, and you have to be prepared to separate. The key here is, one of the keys of this is you don't want to bypass people in this kind of chain of command. If support isn't doing what you think they should, don't go right to your account manager. Talk to the support manager. You may misunderstand what's going on in support. If your account manager is not returning your call, maybe he's on vacation. Don't go to the executives right away. It's important to kind of stay through this path. You'll get a lot better service if you do. My little generalized path that I gave you, it is very general. So you want to find out what your vendor's path is. Usually your account manager is happy to share this with you. Talk to them and say, what is my escalation path? And they might be really glad to tell you and even give you information on that. Every now and then study your vendor's website. Look at that executive contacts, that About Us page. See if there's any changes. Try to read between the lines. Getting a copy of that org chart. I always like to check my vendor's website for job openings too. After Meaningful Use came out and all the stimulus money, every vendor had hundreds upon hundreds of job openings for implementation and support and development. And if you look at your vendor's site and you see that they have 100 job openings in their help desk and no job openings in implementation or development, that might be a concern. And that might be a reason that you're not getting your problems resolved, or you want to see a balance and hopefully not too many job openings in areas like support and development. So check your vendor's website. Be mindful of stepping on toes. Like I said, don't go around the escalation path. Use the escalation path. When you escalate higher, you're going to need to get more specific and have more evidence of the problem. Make sure that you're prepared to have a well-documented description of the problem, a well-documented description of what you've done to resolve it, who you've talked to, and have evidence of what the risks are. What the risks are, how many people are affected, how many other customers are affected as well, can be helpful. And then understand your contract. Read your contract closely, especially the sections on support. Oftentimes there are remedies for disputes that require you to submit your dispute in writing and have it sent to a very specific place. Once you do that, you may be able to hold back on support fees and other fees until they resolve the problem. But you have to follow that, the letter of your contract. There may be response time guarantees in your contract. Most contracts do have that. And there may be penalties for not living up to them. So understand your contract, review it. Leverage is something that we want to talk about too, that you have leverage when you have something the vendor wants. So if you have submitted your letter indicating you're not going to pay support fees until this problem is resolved per your contract, now you have money as a leverage. Or maybe the vendor is trying to close some deals and they're looking for a recommendation. That can be a lot of leverage. Another one that I've oftentimes used when I'm not getting the service that I think I should get on a bona fide problem is I will say, to the account manager, I really want to be a happy customer and I really want to be a reference client for you. I feel like I can't be that today because of the way that you are performing. That can really make a big difference. But after you say that, you better be prepared to be a reference customer. If you're just saying it to get your way, that's not going to help. Sometimes being a loudmouth can give you some leverage. That they want you to be quiet. If you are at a user group meeting and you're talking about this problem that they can't resolve, that can make them want to resolve that problem too. So again, look at your contract, understand how you can withhold payment, talk with your peers and learn how to escalate properly. But use it wisely. Don't make idle threats. Understand their priorities and motivations, like we talked earlier. And don't forget that they are your partner. Don't burn bridges. It's best not to try to get your account manager's head on a stick. I've heard people say that, and that may not be the best approach. Think of them as your partner and remind them that you see them as your partner, not as an adversary. So how do you be that squeaky wheel while not crying wolf? Understand timing. If you don't want to, start sending out email messages with high priority and using ASAP in the subject line, unless it's you've given the appropriate amount of time for support to resolve the problem. And that ties right into don't escalate unnecessarily. You ask why it hasn't been resolved or why it hasn't been escalated already. Ask, when will it be escalated? And ask to escalate. Don't threaten. Don't use escalation as a threat. Don't say, if you can't resolve this, I'm going to escalate this. Or I'm going to call the account manager if you don't resolve this by tomorrow. Don't do that. Don't use it as a threat, because that will be the crying wolf situation. If it's a chronic problem that you're not getting your things resolved, talk to your account manager, or even the support manager, and ask for weekly status meetings. If you have an issues list that's getting long and things are not getting resolved, that's time to put together a weekly status meeting. Get them to focus on it, and you to focus on it simultaneously and discuss where these issues are going. If you're always having to go to either your account manager or the support manager or even executives routinely, if it seems like it's part of your job to constantly be escalating, following that escalation path, then you probably need to step back and say, is it me or is it them, right? Is the vendor not performing, or am I escalating everything? What are the problems here? It should not be routine. This is not something you should be doing all the time. So talk to your peers and see if they're experiencing the same issues. It's a good idea to keep in mind that everybody is unique, right? And some hospitals, healthcare providers, are a little bit more passive, and they don't expect their vendor maybe to perform all the time, and they may not want to escalate things. But somebody who's experiencing the same issues as you, that's something you want to know, that hey, I'm not crying wolf. I need to be the squeaky wheel. I need to maybe partner with my peers as well. So that brings us to the topic of separating from a vendor. There are a lot of things that indicate that it may be time to separate based on the vendor is in trouble. I mentioned job openings on their website. So if you hear from the support staff that kind of on a back door that they're frustrated because they don't have enough people in development, or there's not enough people in support to really help you, but you look on their website and they don't have any job openings, that's a bad sign. That's generally a very bad sign. When you see a high turnover in sales staff, if you have a new account manager every 6 months, and not because they got promoted, but because they left for greener pastures, the account managers and the sales staff are usually the first ones. They're the first ones to leave a sinking ship. If you see them leave, then there's something going on. Not necessarily the support staff, the sales staff. They're paid based on performance, and if they can't sell the software, if they're losing customers, you'll see them leave. If critical issues are not being resolved, if issues that are definitely look like critical issues are high risk, they're affecting all of their customers, and they're still not being resolved, that's a sign that you probably need to get away. That your vendor's in trouble. But switching vendors is extremely expensive. It's very expensive. And you probably have a contract that says your support fees are due for the next 3 years, whether you like it or not. So you want to look at that contract because you're both going to have to live up to it. Contracts are really tested during the separation phase. You want to look at that contract and understand if there's a way out of the contract, what you have to document to show it. You're going to have to get your data out of the system, and that can be very challenging and very expensive. Because once they think they lost you as a customer, they are not going to bend over backwards. They're not going to give you a deal. You're going to pay top dollar to get the data out. So keep that in mind. It's always better to fix the problem than to divorce if you can. So look at that contract. You have to follow all those procedures defined in the contract. There's no doubt about it. If you're renegotiating a contract with your vendor, consider what that contract specifies for data migration. So if you do have a separation, see if you can get some verbiage in the contract, today. If you're renegotiating your contract because your support agreement's up, see if you can slip something in there on that. It's very rare. I don't see a lot of vendors having that in their contract that says if we ever separate, that you can have all your data out for